Every day is upside down day in Sonji land.
Hi and welcome to the Sonji Land Show where everybody's upside down. And today I have a very special guest with me, Emily Lesinski, who is a doctor of physical therapy. So we're going to talk injuries and, well, lots of things. But let's start with some context first. How about you tell us how you got into the handstand world and acrobatics and about your own journey of becoming a physical therapist?
There's a lot in there. So my journey towards handstands definitely began with acro. So my partner Sean owns Warrior Bridge in New York City, and we're about to open a second space. So when we met, which I think was like 2015, I was already a physical therapist at that point. I have a yoga teaching certification, and I grew up dancing. So I was a competitive dancer from like age 6 to 18.
What kind of style?
Jazz, tap, ballet, like sequins, glitter,
cool.
all that. And so having that background, Sean sort of encouraged me towards acro, and I think I was pretty skeptical at first. I was like, I'm an adult. I don't need someone to lift me up in the air. But then, of course, I tried it and got totally addicted to it. And I'm fairly tall for someone that's a flyer in acro. I'm almost 5'7". And it kind of became clear to me after a while that if I wanted to be really good at flying, I would have to develop a really good handstand practice, particularly as a tall person. So I don't want to generalize or stereotype too much, but the really good base flyer pairs are like really huge base and really small flyer.
Well, it makes sense.
Right. Just physics. Exactly. And we're recreational practitioners. Like, I'm not trying to be in circ.
Mm-hmm.
But if we're socially hanging out with other people who are doing acro, it's much easier. I have a lot more self-confidence knowing that my handstand is really solid, and people want to base someone that has like a really strong handstand. So that was maybe 2016. I started practicing handstands more seriously, and it's just grown from there. Especially during COVID, it was kind of like the practice that everyone could do, you know? And we started teaching like a lot more handstand classes during that time.
Mm-hmm. Here at Warrior Bridge.
Yes, exactly. So that's kind of where my handstand journey came from. And, you know, now I'm like aiming for that one arm.
Yeah, and you got like a baby one arm.
Yeah,
you could say
it's like, you know, just the seed of the first initial holds. And so I mean, I started training handstands when I was 30, which
cool.
You know, like I had the background in dance, but I feel like as long as I'm continuing to improve, I'm happy. It's not as fast as some people's progress, but it's progress, you know.
Mm-hmm.
My physical therapy practice kind of came from having grown up dancing, I think. I was always really strong in math and science in school. That was my interest. In college, I was kind of pre-med, or I had some interest in something healthcare related.
Mm-hmm.
And then I think it was my mom had an experience with physical therapy, like she had an injury. And I thought about that versus like med school or becoming a physician, and kind of weighed those options and realized I could stay much closer to the world of like movement, and dealing with people who really value moving their bodies and maintaining their bodies, if I went into physical therapy. So after my undergraduate degree, I went straight into grad school. So I've been practicing physical therapist for 11 years.
Wow.
Yeah. Much longer than I've been doing handstands.
Yeah. So has your practice shifted with you being more involved with handstands?
My clinical practice?
Mm-hmm.
Yeah, definitely. So I used to work in a really big practice where a big orthopedic practice where we would get people with a prescription from their doctor, and everyone from like a 20-year-old soccer player to a 80-year-old person with back pain to a 50-year-old Wall Street finance banker. You know, we get everybody in that sort of setting. And I left that job about 5 years ago because it was really impersonal, in the sense that I saw maybe like 23, 24 patients a day.
Wow.
Yeah. I mean,
Jeez.
we could have a whole other show about the U.S. healthcare system.
But I don't think
um,
it's that much different though in Austria, to be honest.
I mean, basically, if you're going through your insurance, insurance pays the clinician very little. So we have to see a lot of patients to cover our costs and to make any money. So it was a very, very high volume setting. And so I didn't think that I was really becoming a very good physical therapist in that setting. I was becoming very good at like multitasking and juggling lots and lots of people. So I left and started working for myself. Sort of around the same time in my life that I was falling in love with acro and handstands and this studio and this community. So I'm now a little bit known in the New York City acro and circus and handstand community as a physical therapist who understands those sorts of movements and that type of training. And so I no longer accept insurance. I run like an out-of-pocket clinical business, which was a little scary. But I think because of my niche expertise, people see that as valuable, and they come and find me if they're an aerialist or a contortionist or, you know, a performer or a handstander. You know, they'll find me because they have like a pretty specific injury, and then we work on it together. So my clinical practice has definitely evolved with my movement practice.
That's so awesome that you can combine those things.
Yeah, I mean, it's allowed me to kind of find my little corner of the physical therapy world. And it's been pretty cool to kind of learn more about different circus disciplines too. And now I train a little bit of aerial stuff as well. So yeah, it's all kind of come along together.
So working with people who do hand balance and acro, but let's stay more with hand balance. What are the typical injuries that you see?
So there are some that are super common, and then others that are like, you know, relatively common. Number one biggest complaint in handstanders is wrist pain. There's a lot of things that could cause wrist pain. So like that's kind of a broad way of describing it. It's just wrist pain. But you know, well, let me put it this way. You stand on your legs mostly, right? So our bodies are shaped and evolved to stand on our legs, and the structures in your legs and your hips and your pelvis are shaped, and I don't want to say designed because they're shaped and evolved to reflect that function. Our upper body is not. And so when we seriously train handstands and people that are very serious about their handstand training, you're really asking your upper body to do the same thing that the lower body does. And it's simply not shaped and evolved to do that. You know, the structures are entirely different. And so a lot of injuries can come from that, which is not to say that you shouldn't do it. I'm a handstander. Like I really enjoy it, and I think it's an amazing practice. And circus in general is training the body to do things that it's anatomically not really meant to do. Contortion, hanging from the ceiling, you know, things like that. But
so interesting you say that, because then it seems kind of inevitable that you would get injured. How do you see that?
Well, yeah. The other thing that kind of makes injury a little bit inevitable is specializing. So, and this is true across all sports. If you're a college soccer player, you really only train and practice soccer. Injuries are more likely because you're not making your body into a generalist, you're making your body into a specialist. So you're stressing the same structures over and over again. And so I really, even in handstanders, no matter what kind of sport you do, but in handstanders as well, I always stress the importance of cross training. So if you do a lot of handstands, you probably should do some kind of pulling strength as well. You probably should do a little bit of weight training in the gym just to work those other structures so you're not always loading the same structures over and over again. Makes your body more resilient, you know. But we can kind of talk about some of the most common injuries I see. Wrists. I feel like everyone that does handstands has had wrist pain at some point.
Been there.
Yeah. And so that can come from a few different reasons, like structurally, like I said. If I show my foot or my hand, will it come?
Yeah.
Okay. So like on your foot, the weight kind of falls straight through, you know, you have a heel that's behind your center. On your hand on the floor, if you were just stacked here, you would not have anything behind your center. So we actually have to bring the forearm a little bit past the wrist to create, you know, those center of weight landing right here, which means that you need a good bit of range of motion in your wrist. And some people's wrists are just stiff. If you spend most of your day working at a computer, or you have no background in this sort of movement, and then you go to a 75-minute handstand class first day, you're probably going to feel like your wrists are a little sore because they're simply not used to doing it. Or if you're working on a lot of pressing, for instance, there's a lot more forward that has to happen over the wrists. And, you know, so strengthening and making your wrists a little bit more stable and resilient to that action can be really helpful.
How would you do that?
You know, a lot of the standard drills that you see from coaches, like wrist push-ups, incrementally loading your wrists. So not doing handstand as the very first thing, but doing some work in a tabletop or a plank.
Build it up.
Yeah.
Basically.
Working on your tolerance to the planche position. So in a plank, you can kind of lean your shoulders forward and build up your tolerance to that position. But then also just kind of being aware of your handstand technique. And this is interesting because it starts to fuse handstand coaching with clinical decision-making. You know, so if someone has very, very closed shoulders, and that means their shoulders have to be more forward in order to stack over their handstand, they're probably going to feel it in their wrists eventually. So then it's a matter of like, well, how can we assess the technique here and maybe work on the line and do like handstand line drills so that it takes some of the pressure off the wrists. This is where I think it's just really helpful as a physical therapist to practice the thing that the patient also practices.
Yeah.
So I can understand what they're dealing with.
Yeah. I think that's so important. I remember from my background, I was a figure skater, and I went to 3 different physical therapists. None of them did figure skating. And then I went to one and the problem was solved. So it was like the same issue, but
yeah. I like to think, I mean, obviously I'm biased. I just want to be the circus therapist for New York City. But I do think it is really helpful to be able to talk in the same vocabulary as well. You know, if someone's describing something to me, I know what they mean when they're describing their training. Yeah.
Yeah. Well, it's like some people just tell you that it's not healthy what you're doing and you should stop. And just understanding that.
Most common issue I hear from patients coming in is like, well, I went to the surgeon, I went to the orthopedist, and they just told me not to handstand anymore. Which is, I mean, as far as I'm concerned, that's a quality of life problem.
Yes.
You know, like I really, really try not to tell someone that they have to stop training. If I can help it, we might have to modify or kind of change, you know, the structure of their training a little bit in the short term. But I really try not to take that away from people when we're working on an injury. It depends, sometimes surgery is like a special scenario, but try not to do that. So wrist pain is really common. There's lots of other reasons that wrist pain can happen too. There's small ligamentous structures that, again, they provide stability in your wrist, but they're just not the same kind of structure as like the ligaments in your hip or your ankle. Right? It's
like different thickness.
They're much smaller. Yeah, they have different stretchiness. They have different sizes. And there's so many small bones in your hand and your wrist, and all of those structures move with each other in different ways. And the foot is fairly complicated, but it's not as complicated as the hand. So, and that's where probably finding someone that you like, trust, a body worker, a physical therapist, an acupuncturist, whatever, that kind of understands what your training is like, that they can kind of assess these very small structures and your specific needs and treat you appropriately. Mm-hmm. Kind of like
let's move up the chain. I know people who get golfer's elbow from handstands. Can we talk about that?
Absolutely. Elbow pain is also pretty common. Golfer's elbow and tennis elbow. So those describe just two different sides of the elbow. You have a big, your flexor tendons, that mass of muscle attaches on this side. So that's what we would call golfer's elbow. Mm-hmm. And then the extensor tendons attach on this side. And that's what we would call, this is golfer's elbow here. And then
golfer's elbow is inside.
Yeah,
so elbows outside.
I mean, it depends on the rotation of your forearm, but you can feel if you
side.
Yeah.
Thumb side.
If you flex your fingers or you flex your wrist, you can see the muscle kind of bulging out.
Oh, you got a lot of muscle.
I also
nothing's moving.
Well, so that's the other thing is I use my hands to work, and I use my hands to handstand, and I use my hands for acro. So I definitely have very developed forearms.
Yeah.
But so that's your flexors, golfer's elbow. And then your extensors are on like the back side of the hand. And that muscle mass attaches also just at the elbow. And these are tendons that attach just above the elbow joint. So they actually cross the elbow. And there's a lot of reasons they can get inflamed. Golfer's elbow and tennis elbow are sort of loose terms for tendinitis. So that's inflammation where the tendon attaches. Just, again, not being used to the practice. If someone gets really enthusiastic and they go from 0 to like 6 days a week, it can just cause some stress on those structures. Also, the process of learning how to balance can be really stressful on your flexor tendons and your extensor tendons because it's your entire body. We don't usually lift our entire body with our fingers. Like only in handstands really does that happen. And so like preventing yourself from falling over or like catching yourself on the underbalance, that's a lot of work for those small muscles. And so it can just kind of create stress at the attachments. Also, there can be technique issues that cause elbow pain. So again, if someone's constantly undershooting on their jump and you have to like bend your elbow a little bit to kind of catch your handstand and finish, it's going to create more stress there. So coaching versus PT, that's another area where they sort of come together.
Can it also be influenced by your strength around stabilizing the scapula up there?
Absolutely. Anything that happens at the wrist or the elbow, I'm always assessing the shoulder as well. Because usually if there's a microbend in the elbow or you have to planche to save your handstand or anything like that, it's often a result of the shoulder not doing what it really needs to in the handstand. And again, that could be strength or just lack of awareness or not understanding the technique. But yeah, I'm definitely looking at shoulders with any upper extremity issue that comes in, really. The other thing that people always want to know about is elbow hyperextension. in handstands. It's not unsafe. If you have hyperextended elbows,
You can lock them out.
it's fine. You can straighten them.
Cool.
If it bothers you, if you have elbow pain, that's something to look at. But it's not dangerous to like be on a hyperextended elbow. Sometimes it's actually helpful for one arms because you can do elbow balancing. But I do know people that have hyperextension who get elbow pain, and that's because maybe they have a significant amount of hyperextension and they train one arms and side bends a lot, and it's just really leaning into those joint structures. So I have methods for addressing that. It's not to tell the person to bend their elbows in their handstand.
But what would it be?
So usually for that type of person, because a lot of circus artists have elbow hyperextension.
Right.
A lot of acro flyers have very hyperextended elbows. I usually have someone train like with a band around the elbows and just create a little bit of pressure against the band, which for someone with hyperextended elbows is going to feel like they're bending, right? But I don't actually want them to unlock necessarily. I just want to create a sense of outward pressure against the band. And basically that turns the bicep on in a way that's just protecting the joint. So teaching the body how to use more musculature and not just rest in the joint.
Yeah.
That's kind of true for anyone that's super flexible in their joints, anyone that's hypermobile. That's a strategy that I use. Turn on more muscles.
Yeah. I feel like that's generally a good idea.
Yeah. Keeps you safe.
Let's talk about shoulders.
Shoulder pain, shoulder issues is really common in handstands because the shoulder is way more complex than the pelvis. So the pelvis is what we normally stand on, right? So you have a hip joint that's really deep and you stand on your hip joint and the socket covers the ball. So your pelvis is way more stable and there's not really a lot of problems that come from weight bearing on your hips because they're built for it.
The joint just isn't as movable.
Yeah. Your shoulder has a scapula, it has a clavicle, it has your rib cage, and it has an arm bone. So there's just all these moving parts, and we're trying to create as little movement as possible in our handstand. So again, this is an issue of how much muscular support can you create around all of these moving structures. And some people, maybe their scapula doesn't move as much. Maybe they are very, very right hand dominant. They always carry their bag on their right side. So their right scapula doesn't move as much as their left scapula. So then in their handstand, they're leaning off of one side, can create pain and wear and tear. So it's really, really case by case, like why shoulder pain happens. This is where a really good assessment is really important. You know, someone to kind of watch and look at your posture and look at your arms moving and your range of motion, but also to actually look at your handstand and see if there's something going on there. Impingement is really common, rotator cuff impingement. And I would say most of the time, and I talk about this in handstand anatomy lectures, this is kind of a soapbox for me. I would say most of the time, people don't need to stretch their shoulders for handstands. Yeah. If it's hard to get your shoulders open in your handstand, which it is for most people when they're first starting, it's mostly a strength issue or an awareness issue and not really a flexibility issue. There's a really good test to understand whether you need to stretch your shoulders, which I can show if we can use the stall bars.
Sure.
Or chin up bar. Basically, if you can get to like a straight line with gravity helping you, then you don't have a flexibility problem. So you can just use a chin up bar.
Makes a lot of sense. Yeah.
So if you have a chin up bar at home, or you know, if your coach has a chin up bar, and
Or do your hands have to be shoulder wide? Can they be wider?
Shoulder width if you're thinking about handstand flexibility, right? So I'm going to hang and I'm going to draw my ribs down, tuck my tailbone, and make my handstand line. And maybe look up at my hands. And, I'm not piked. I'm not arched. I'm really trying to make my handstand line. And if I can make it here, then I don't really have a flexibility problem.
Your body has the range.
Right, you have the range. It's obviously much harder to do it with all of your weight on your hands and balancing. But in that situation, it's probably more of an issue of the strength of sliding your scapula on your rib cage. And that's where, if you haven't quite developed that and your body's using other things to get over your hands and stay there, that's where you can get rotator cuff pain or like biceps tendonitis and that kind of thing. So that's my trick for you today.
Cool. Yeah, I love that. So what about all those people who can't access that? How do you safely develop your shoulder girdle for handstands?
Yeah, I mean, I think most people don't understand that their scapula can move. So especially if you are coming from like a normal civilian job. And people just don't think about how their shoulders move most of the time.
So awareness is like a big starting point.
Absolutely. People like us, we think about these things all the time, It's like, I wonder what that means in my shoulder, but a lot of people don't sit around thinking about how their bodies work.
It's very true.
So, starting with something as simple as like scapula push-ups in a plank, and then taking it maybe to a downward dog. And can you slide your scapula in a downward dog, for instance? And then even in like a wall handstand, feeling the difference between sinking and then fully elevating and sliding the shoulder blades apart. And it's heavy. It's just, for a lot of people, we don't do it most of the time. And this is close to the end of most people's flexibility. Like for me to hang from that bar, I feel a little bit of stretch. And so this is true everywhere in your body. When you're at the end of your range, that's where you're not strong. So it just takes time to develop it, really. And I would say, if anyone out there that's like a personal trainer or has worked with programming a workout, you can kind of be intuitive about that. Like if you're starting a handstand journey and you're worried about overloading your shoulders or your wrists or whatever, you just take it incrementally. If you can get really exhausted after like a half hour, your first couple of times, great. Maybe you add 5 to 10 minutes. Maybe you add 1 extra day a week, and don't neglect the recovery stuff too. Roll out your wrists when you're done. You can do a little trap stretch when you're done. Like cooling down from your handstand practice is important too, especially if you pushed really hard.
Yeah, I never do that.
If you have built up your body's like resilience to the practice, most of the time it's fine to just like drop your blocks and walk away when you're done. But for people, like when we teach classes, for instance, I can see it. Like by the end of class, people are like, they're like shaking out their hands, shaking out their wrists. And so I always end class with like 5 minutes of feel good stuff.
I love your classes.
Oh, thanks. You can, do like self massage. You can use like a peanut or a, mobility tool in your forearms and your traps, upper back, all that stuff.
I feel like we're opening up a box and we're just getting started.
Yeah. Well, so I would say like we talked about upper extremity stuff. Those are certainly the most common issues in handstands because it's an upper body based activity. But like there's other things that come in as well, but they're just kind of less common, I would say. Just to briefly mention, one thing that is actually surprisingly common in handstand training is chest pain or like rib pain.
I have that. Not necessarily pain, but my ribs crack open when I'm done with handstands, and they often just crack.
Yeah. In general, noises are not dangerous. So if you have clicks and pops and things that make noise, as long as it's not associated with pain, I wouldn't worry too much about it. Bodies are not like computers, we have lots of moving parts, and you can't just like swap out a new part. So things make noise sometimes. If it's painful, that's another story. A fair number of people, I would say, get pain kind of in the rib cartilages where they connect to the sternum, or they get noise, popping, clicking. I have to be honest, at this point, I haven't found like a great clinical approach to that. It's so uncommon outside of circus. Like it's pretty common in the circus world, and it's really uncommon outside of circus. So it's really not well studied.
Yeah.
That being the case, I really think it's related to the fact that we're using our upper body in the way that we would normally use our lower body, So your ribs connect to your sternum with cartilage, not with a joint. So there's not really like a joint here that has like joint structures and ligaments. It's like you have a rib and a sternum and then a whole chunk that's just cartilage. And the reason for that is we want our ribs to be able to expand, to breathe. But that's not really a weight bearing. It's not really meant for weight bearing.
Does the cartilage get stronger with your practice?
Yeah, I mean, I think some people just have looser connective tissues and like bouncier cartilage structures, and perhaps that can be a little bit more susceptible to pain. But I've experimented with different treatment approaches for it. I do try to make sure that like my pecs are not, I occasionally get pain. I try to make sure that my pecs are not really tight. A lot of people that train handstands can get tight in the pecs. And those muscles attach right here.
Yeah, I notice it when I do press training, or after press training, that's when it gets super bad, super tight.
So I think that can be related to your ribs also attach in the back, right? So you have rib attachments in the back of your spine and then in the front at your sternum. I usually try to make sure that if someone comes to me with chest pain, that their thoracic mobility is in check, making sure that we can get as much range as possible from the thoracic spine. Because if that's kind of stiff, then you might be taking the hit in your ribs instead. Because with the press work, it's like a lot of deep rounding, right? And a lot of pushing through that deeply rounded position. So I check on the thoracic mobility, make sure that we're getting as much from that as we can. But like I said, I'm still in the troubleshooting phase of that. There's other stuff that's comes up every once in a while, lower back pain, hamstring pain. I think that's more associated with the mobility involved in handstands. So, but
I feel like we have to come up with a series with you.
Sure.
Go into more detail, because
yeah,
we're just barely scratching the surface with everything.
Yeah, I mean, so I've done a handstand anatomy lecture a few times now, and I think I'm gonna do it again soon. And that's kind of, I do that like a workshop style, and I kind of go through the different parts of the body in this way. And I think with these kinds of things, you can't say it too often. Like, we can have it on many different platforms and say it in many different ways, and the more people that can consume it, the better.
Do you do that for your teacher training here at Warrior Bridge?
We do go through a lot of it, and we have an anatomy and movement training. So like we do a lot of handstand training in that.
So it's not a teacher training. It's like...
it's a training for, yes, it is a teacher training, but it's aimed at people that want to teach many different kinds of or any kind of movement class, really. So it's heavily focused on anatomy. We kind of go through each region of the body. Like, this is what the shoulder girdle looks like. These are all the muscular structures. These are the joint structures. These are the ligaments involved. This is why the scapula should move like this. And then we apply it to handstands, flexibility, yoga, calisthenics. And so when we do that training, we hope that people come away from it pretty confident to teach whatever they want. So it's not just like, this is the class you're going to teach. It's like, here's the information, and then you develop the class that you want. So we do go through a lot of that.
Cool. Okay, so I have one more big question for you.
Sure.
We gotta make sure we can still we can make it work with the storage.
Okay.
I think we have like 10 minutes.
Sure.
Is that right? Okay. So how has your knowledge of anatomy informed your teaching and your training? If you
That's
want
a
to stick
really-
with the teaching.
Yeah. I will just be totally candid and say that my training, like my personal training, I'm not great at applying my own clinical knowledge to my own body.
Why not?
I think that's true of a lot of people in healthcare. Like, I'm a very bad patient. You know, like in the last few days, I've had this like interesting kind of little twinge in my hand, and you would think like I would investigate that and kind of look at, is there anything happening in my neck or my shoulder or whatever? And instead I just whine about it. Like, oh, my hand is feeling weird. I'm so frustrated. And I think probably it's because it's what I do as a profession. So then if I'm having something going on, I'd rather have a friend take care, you know. And I do have a couple of people that I seek out if I really am having an injury problem. I'm quite lucky in general with injuries. I don't get a lot of them. But if I'm really having an issue, I want to take it out of my own brain and like have someone else deal with it. So I will say that. I think honestly, having a partnership with Sean, that has really informed things in an interesting way, because he's so curious about anatomy and like, if I do it this way, why does it feel like this? And if I do it this way, it feels like this. And then, you know, he'll ask me about it and we'll have a conversation. And then his teaching evolves based on what we talked about. And then I look at his teaching and I think, oh yeah, that's good.
That sounds so cool to me.
So then, you know, we kind of like inform each other. Like, I think my clinical knowledge informs his teaching informs my teaching. You know, it's kind of like cycles around like
awesome.
that. Yeah. I do try to design my classes in a way that's like, I would never just have someone start with a plank first thing. It's like, we have to warm up your wrists first. I know my wrists don't go past 90 degrees when I first get up out of bed. So, you know, and I try to teach people concepts that maybe they wouldn't get in like a standard yoga class or a standard handstand class. Like, maybe someone will come away from my handstand class understanding what scapula upward rotation is. If I can do it in a way that's not too technical. I don't like to use a lot of technical anatomy language in a big group class. But
basically it's this.
Yeah. Like I'll use like hand gestures and like shapes and stuff like that. But like in the long run, you don't have to know the Latin word for like the muscle. You just have to know what is supposed to feel right and what, you know, to avoid basically. So that's the shortest answer I can give, I think.
I would love to keep talking though. How do you train yourself right now?
Honestly, it's quite hard to have a regimented training. Personally, it's hard for a number of reasons. I'm about 5 years into working for myself. I still have a little bit of the mindset of someone that just started, I think, in the sense of like, I gotta hustle. I gotta like do the grind. I have to like say yes to everything. And really just recently have I felt a little bit more confident chunking out my days where it's like, no, Tuesday afternoons from 2 to 5 is training time. You know, like that's just a hypothetical example, but Whereas in the past, I would say like, oh, maybe it would be nice to train during this time. And then if someone asks for an appointment, of course, I'll give the appointment. You know?
I know what you mean.
So I'm just starting to get a little bit better with it. But I will say, in general, I kind of just take my training time wherever I can get it. Sometimes it's 45 minutes. Sometimes I end up with an afternoon that I have like 2 solid hours. But I try to take lessons when I can. I find that having like someone directing me is really helpful. It keeps me on task a little bit more. Maybe here and there, I'll ask someone to do some programming for me. And then of course, having a partner that's also training can be helpful because it's like, oh, are you going to do handstands for the next hour? Okay, I should do handstands for the next hour. So.
Yeah, that is so awesome. Yeah. Seems like a really cool relationship you guys have.
It's not all glamorous. Like we have our difficult times too, but it's definitely very mutually beneficial. Like we've kind of built a unique thing out of our separate parts, So
I love it so much. Thanks. Okay, so just to recap, the main thing I got out of what you told me right now is to build up the load slowly and just basically
progressive loading is like kind of the basic like approach for pretty much every injury rehab and really good assessment.
Ooh.
Get assessed well.
Okay.
And if someone, viewer, listener, student doesn't know someone in their area, can reach out to me. I have a little bit of connection in a lot of different places. I don't know someone in every city, but I can always try.
Should build a network.
I mean, I have in the US, I have a pretty good network, I would say. There's some other circus PTs out there that I definitely chat with on a regular basis. I'm starting to know people overseas a little bit as well. But if COVID has taught me anything, it's that I can be pretty effective with remote assessments too. So.
Oh, that's great to know.
I am. You can always find me on the socials, and if I can't recommend someone, I can at least try to do the assessment part and give some advice.
Awesome.
Yeah.
Thank you so much, Emily.
This was great.
Yeah.
I had such a good time.
Thank you all so much for watching. I hope that we can come up with a series and maybe dive deeper into specific problems because we kind of just got an overview here.
Yeah,
but we'll talk about that later. I don't want to
totally.
put you on the spot. But in any case, check out Emily. We'll put her information down below. And if there's anything specific you would be interested in, then put it in the comments section. And other than that, it's never too late to do what you love. And I'll see you next Monday on the Sonji Show. I could talk for hours. I have so many questions.
Oh my goodness.